From Florida's Space Coast, this is your career.
Welcome to Your Career. I'm Debbie Featherston, your host, and with me today is Dr. Kristin Schroeder, who is a physical therapist. Kristin, thank you for joining me.
Thank you for having me.
Well, I'm so excited about this program. We've been wanting to take a close examination of a variety of careers within the medical field, and physical therapy is one that I don't think is always talked about as much.
True.
And yet it makes a huge difference to the quality of a person's life, whether
Exactly.
it's after an injury, a strain, whatever it might be. So how did you choose
Physical therapy.
physical therapy?
It might sound cliche, but I really think that physical therapy chose me. When I first went away to college, it wasn't my intended major, and I was exploring healthcare fields, just like many students are. And I had a good friend say, hey, you might want to try this out. It might be a good fit for you. So I did, and I started volunteering and shadowing and getting to know different physical therapists in the area. And I realized this is something that I want to do. In physical therapy, we have such a unique opportunity to really develop relationships with our patients that are beyond just a meet and greet.
Right.
And it's not just the patient, it's the family that gets involved. I'll never forget the first time I had a patient that had had a stroke and seeing them walk for the first time, and not just the excitement on their face, but also their family's face, to know that I really made a difference, not only in the patient's lives, but everyone that they love too.
Well, you're being instrumental in giving them their life back and
Right.
helping them to do things that maybe they didn't think they could do.
It's not always an easy job. I mean, the name is physical therapy, so it's a lot of work. But at the same time, I have many days that I go home feeling like I've really done something that's going to benefit so many people. And it's so rewarding to know that I have made a difference. And there's so many different patient populations that we put our hands on that you can help somebody walk for the first time. You can help an athlete get back on the field. You can help a young child, learn how to sit up on their own. That's huge.
Yeah. Curious, can you tell us just a little bit more about the role of physical therapy?
Sure. So we're healthcare professionals. We get patients, like I said, of all different ages, and some are coming to us with maybe a medical diagnosis or a health-related condition that's impacting their daily life. So really what a physical therapist does is they examine a patient and evaluate them and determine a plan of care that's really going to meet their functional needs. So what's important to you as a patient? Is it you need to be able to reach your arm up overhead to get in a cabinet? Or do you need to be able to run because you're a sprinter? Whatever the case may be, we're taking their functional desires and making them a reality. And again, it's all different settings. So it might be in a patient's home because they can't come to outpatient. It might be in a hospital because they've had pneumonia and they've been in bed for a week and now they can't walk. Or it could be in an outpatient clinic or a skilled nursing facility. The options are really endless of what we do and how our role varies in all of those different settings.
Well, the one thing that I don't think a lot of people realize until you just said it is how you, a physical therapist, have such an impact on a person's life. The mental state of some of those patients when you first meet them. I mean, I'm thinking back to the stroke patient, if it's a young child who,
Right.
I mean, people are probably stressed, maybe a little depressed.
They are, and I think part of our job is to really explain to the patient the benefits of physical therapy and why we're doing what we're doing. I feel like a lot of times a physical therapist can just go through the motion because that's what we do. We do bicep curls because we need to strengthen your arms, but we never really think about why we're doing it. And once you can explain to the patient, hey, like this is going to help you, reach into that cabinet or whatever it is that they want to do, they really buy into physical therapy and what it can do for you. So,
Because I think that motivation is huge.
Right.
If they're not motivated, how much progress might they make, depending on the injury?
and a lot of times not a lot because they're not taking it seriously. We can only do so much during our treatment sessions, and each therapist has their own way of treating a patient, whether it's hands-on or whatever the case may be. And a lot of times it's based on their credentials and what they're skilled in. But if a patient doesn't take what we do and go home and practice it with their home exercise plans, they're not going to get that far. It's, we can only help them, give them the tools they need, and then they have to apply them.
Right. So hopefully you can positively impact the motivation, the morale, so that they really embrace it and do what they need to do.
Right. A lot of it's trial and error, finding out what works for that patient. Because some patients I can say, I need you to do this exercise 5 times a week, and they do it. And then other patients I need to say, do it while you're watching TV. Don't make it such a big deal. And they get it. They make it part of their life. It's not just physical therapy anymore.
Yeah, that's good news. What about the education and training associated with being a physical therapist? What does that look like?
Well, it's a professional degree now. So in the United States, entry level is technically a doctor of physical therapy at this point. There are clinicians that are practicing that have bachelor's and master's, but the field is evolving to a doctorate for those choosing to go into it now. So the students will have to do an undergraduate degree, a 4-year degree, and this varies. Sometimes they'll go into exercise science or pre-health or kinesiology. And then there's others that choose to go into maybe business management or public relations or even psychology, because those parts, even though they're not science-based, directly impact how we treat our patients. So after the 4-year degree, there's certain prerequisite requirements for sciences. So if you're in a psychology, you need to make sure you have your anatomy, physiology, physics. But after that, you would apply to a school with maybe a GRE score, maybe some shadowing experience. A lot of schools require, at a minimum, I would say probably 75 hours for a professional degree to have shadowing experience. So you know what you're getting into, which is always a good thing. And then you would apply. The professional degree portion of it varies from, some schools are 7 semesters and some are 9. They all are teaching the same content. It's just how they lay it out. So if you're choosing a school because it's in 7 semesters, you need to realize that you're going to be taking a lot more credits than the 9-semester one. So it's a great option for those that maybe need to get through it a little faster. If they have a family or they're moving or whatever the case may be, there's lots of options for it.
So what are how does one go about choosing a school? I mean, you talked about the differences in the length of the semesters or the number of semesters.
Right.
But what other factors?
First and foremost, you need to make sure that you're going to a program that's either accredited or in the process of being accredited by CAPTE, which is the Commission on Accreditation in Physical Therapy Education, and they accredit all of the PT and PTA schools nationwide. The importance behind that is, in order to sit for the board exam following graduation, you have to complete a school that's been accredited by this.
Gotcha.
So what's great about CAPTE is they have really high standards. So almost all the schools in the nation are really great because they're all having to meet minimum requirements. Physical therapy is getting really competitive, especially with, some of the trends that are in physical therapy, especially in the state of Florida, with us having direct access, not having to go to a primary care doctor to get a referral before you come see us, is really opening doors for patients and for ourselves as clinicians.
So let me go back and make sure that I understand that. In the state of Florida, there's a shift where instead of getting a referral from a doctor, they could seek out a physical therapist directly. So thus the payoff for the larger degree, the extraneous training and
it's all related, and it's in the process still. There's still a lot that needs to be done because of insurance companies have to buy into it, bottom line. But it's really given us an edge on what we do and really showing that we do a lot for patients. It's so much more than just exercise. Some of the skills that a student needs to have that would, transition to a clinician is really that concept of critical thinking. Can you think beyond an ankle sprain? Like, how are you going to take that patient's case and make them better? Because I've never seen 2 patients that have the same diagnosis that I treat the exact same way. And I think that makes me a better clinician because I look at each patient so uniquely. There's different factors that are going to affect everything. If you have a 15-year-old versus a 65-year-old, what's the difference? There's a lot. It's beyond age. It's what are their functional desires? What are their comorbidities? What kind of shoes do they have to wear? Every day.
Right. Have there been additional injuries
Exactly.
or, other people, leaning on them, whatever the case, right?
Right.
So many different variables. Yeah, I have a greater appreciation of physical therapists the more we talk here. But, I was curious, what have you found to be maybe one of the biggest challenges of physical therapy?
I think for me, when I first started out, you go through school and you have all of these clinical internships, and you have a clinical instructor that's overseeing everything that you do. And then one day you are the physical therapist. And finding that confidence in yourself that you know how to treat that patient. I think sometimes that's hard, that we get a patient that we've never seen before, or a population that we're not comfortable with, and we kind of get scared. But it's really, principles of physical therapy are pretty consistent across the board, regardless of what patient you're treating.
Yeah. That doesn't surprise me from what you're saying. It's really fascinating. What might a career in physical therapy really look like? So if we're looking over a period of time, how might it progress? I mean, we start out...
Right. There's really not a snapshot of that, which to me is so appealing. You don't have to stay in the same area or setting forever. And, so most therapists do work 40 hours a week. They might work 4/10s or 5/8s, but they'll work in a setting with a patient population, and depending upon what their goals are, they might evolve into different specialties and different certifications where they're going to kind of zero in on what they want to do. So you might be a physical therapist that works in an aquatic environment, so you're in a pool 8 hours a day. Or you might be working with pediatrics, so you're playing on the floor with kids, which is so difficult. It sounds like fun, but it's a lot of work. Or you might be on the sidelines of a football field, helping athletes, in the moment and after it happens. So it really varies. I've enjoyed working in a hospital. I've enjoyed working in outpatient. I got the opportunity to help out with a sports team, a local one, and it's been really great. And each of those experiences have only made me better, because I'm taking it and applying it a little bit differently and using different skill sets that I wouldn't get to use if I did the same thing every single day.
Because I know some people may think about, I'm going to go into physical therapy, I might work in gerontology, injury, all these different groups and environments that you've described. But also there's that progression of, I'm moving from physical therapy, I'm going to be a physical therapist, but I'm going to be a supervisor of a physical therapy unit.
And that happens a lot. There's really no limitation of what a physical therapist can do. And I say that loosely. I mean, obviously, within the constraints of a company. But, there's physical therapists that have worked their way up in hospital systems, or, worked in school settings, or whatever the case may be. There's no reason why they can't do that. It's more, are you focused? Are you willing to meet different criteria? There's certain criteria to be a physical therapist, and there's different criteria to be a manager or director or whatever the case may be. So if somebody chooses that, that's an option. And a lot of physical therapists make great leaders, because they have to critically think every day, and that's what managers do.
I was also thinking about the actual skill set of the physical therapist. Like if you have to massage an area, or you're looking for how much tension you might have in an area, or something like that. Over time, and I would imagine few years, that there's an added sixth sense.
There is. There's definitely a finesse in how you feel about your hands. And, the biggest joke I feel like sometimes in our field is, these are my money makers. Like if I don't have my hands, I don't have a job. And so you really learn to, when you are massaging a patient or moving their arm, what are you feeling? It's important to know what normal feels like, so when abnormal happens, it like bites you. Like, I know that that's not right. I might not know exactly what it is right now, but I know it's not normal, and that's just as important.
Absolutely, I would say so, because if you sense it, and of course, if you're working with the same individual over an extended period of time, and I don't know what the usual length is. I suppose it depends on the circumstance.
Right, it depends on, have they had surgery? Are they under doctor's orders maybe that they're limited in what they can do from the beginning? It might be a patient that comes in and really they just need a home plan. They need somebody to kind of educate them. Physical therapists even work in the work setting, and they'll go in and look at ergonomics. And sometimes that might just be, I need to come in and view you and see what I can do to help you so that your back doesn't hurt at the end of the day. And then they might come back a second time, and that's it. Or we have patients, say, go back to like a stroke patient, for instance. It depends on how neurologically they're healing too. We can only do so much, and then the body has to kind of help us out a little bit. So.
And sometimes it takes time when you're talking about nerves, because I forget or the regrowth rate, but it's very slow.
It's very small. It's like millimeters,
Yeah.
you know.
Yeah, so,
So
it
it
takes a
takes
long time.
Right.
So take care of that body, right? Well, what are some alternative career tracks that might exist for physical therapists?
There's lots of different specializations within therapy. We have an American Board of Physical Therapy Specialties. And what this does is allows individuals who have advanced knowledge in certain areas, some are neurology, orthopedics, geriatrics, pediatrics, sports, women's health, cardiovascular, pulmonary, and the last one is clinical electrophysiology. And what they do is, for somebody that's had advanced training, they can sit for an exam and then be certified as a specialist in this area. But what's so great about it is it really helps the patient population. It's really geared towards consumers, because if I know that they're a specialist in it,
Right.
that's who I should be seeing. If, you know, instead of just, I'm not saying that somebody that doesn't have it isn't as good, but it really helps patients know, hey, they've done advanced training, they're going to be able to help me.
Right.
There's also different ways that we can become credentialed outside of specialization. So like we talked about, putting our hands on patients, manual therapy is pretty huge, and it really helps patients. So you can be manual therapy certified. Lymphedema has,
But that has really come a long way, hasn't it?
And now we have therapists that are lymphedema specialists that are really helping that population. Women's health, even though it's a specialty, you can also get credentialed in it. There's lots of options.
Well, it's pretty impressive that you have the wide range of specialization in addition to the management track that we talked about earlier. When you think about the requirements to maintain the licensure as a physical therapist, what's really involved there?
So every 2 years, a physical therapist must demonstrate to our boards that we've done 24 hours of continuing education. Some of the hours must be in medical errors, just to kind of keep you up to speed. But those can be in really whatever you want. So a lot of people choose those hours to maybe refresh something that they haven't done in a while, just to keep it, like I said, fresh. Or they might choose, like, they're going into a specialty, so they want to take some extra classes to prepare for that. Or it could just be something they're interested in, with alternative medicine being, up and coming, and therapists incorporating that into our normal practice. Some therapists are even looking at those types of classes. So they must be accredited from the Florida boards, or approved, I should say, from the Florida boards.
Okay. And is, let's say, for example, let's take an example. I know that you do some work with Health First in the area. And would they offer continuing education for you?
We do. So they offer stuff that's on site for us, that they'll have, there's like a neuro conference and an orthopedic one, and then they give us our medical errors one too that's online. So some companies do offer it, and that's a great feature when you're looking, even as a new grad, but even as somebody that's been working, as part of your benefit package, because they're not necessarily cheap credits. And so when you have a company that's willing to help you out or really kind of help you pursue your goals, that's when you found a great company.
Yeah. I want to go back to something that we talked about a little earlier, particularly somebody that's trying to determine, is physical therapy really a fit for them? And I'm kind of curious about how somebody, let's say we take an individual that has a degree in, I think you said exercise science was one of those options. And so if somebody has a degree in exercise science and now they're trying to explore, physical therapy, what are they looking for? How do they determine what might be some of the triggers that would go, yeah, this would be a good fit for me?
I think it's really that you want to help people, and I know that's
Broad.
healthcare, but they really have to want to help them in a way that it could be 6 weeks that you're with this patient, and really willing to develop a working relationship with them until you meet their goals. And sometimes, physical therapy isn't always glamorous. There's things that we do that we have to do it to prep to treat them. And so I think shadowing opportunities, which a lot of the schools require, is a really great way to see, do I really want to do this? Because sometimes it sounds great because you've only seen the physical therapist that's on the sideline, but you've never seen the therapist that's in a skilled nursing facility. And they're both great. And
or
you
an
don't
outpatient clinic.
Yeah,
or,
exactly. Or even a hospital sometimes, and trauma floors and stuff are very different than even a med surg floor. And so getting the opportunity to look at some of those different ones, I think, like I said, the biggest thing would just be really having that desire to help people and to truly help them, because you're not meeting your goals, you're meeting the patient's goals. And sometimes that's hard for people when they're only looking at objective measures. That's not always important to the patient.
Yeah. If you were going to hire somebody to the Health First team, knowing that you're not in that role, but if you had a seat at the table, what might be some of the things that you would look for?
I think that they're willing to engage with people. They're not just going to answer the question and sit back if they were in an interview. They're willing to kind of take it to that next level, because on paper, people can look really good. They can have straight A's, they can have perfect test scores, but they can't relate to people. And it's really important that they're also willing to work as a team, especially at the hospital. Our rehab department includes speech therapist, occupational therapist, and then physical therapist, and willing to work together and knowing when somebody else could do a better job is really important. Knowing your limitations is just as important as knowing your strengths in our field.
And just that team, you've mentioned that a few times, and how you need to collaborate and confer with each other, bring somebody in, get an opinion, maybe have somebody partner with you on that with that patient.
A lot of times, you'll have a patient and you just can't figure it out. And sometimes that fresh set of eyes is all you need, because you've been working with them, you developed that relationship, you're so comfortable that you need just that, hey, what is it that I'm missing? And so a lot of times, personalities don't click. That's human nature. And if I'm expected to be with a patient for 6 weeks and we're not clicking, we're not going to be successful. So that's the great thing about the community of PTs and OTs and speech therapists.
I think that's phenomenal. So what are some of the trends? Early on you'd mentioned that there was a number of trends that are at play right now. So what are some of the trends or current business practices that have maybe shifted?
So like I talked about was direct access, which is huge, and that kind of relates to insurance companies too. They're really looking at us now because a lot of doctors are prescribing therapy, and what they want to see is it functional? So kind of what we've talked about, making sure that therapy is functional, is skilled, isn't something that someone can reproduce in their home. So making sure that what we're doing in the clinic is different than what they're doing at home is really important. Another thing is, we call it prehab. A lot of doctors are sending patients to us before they have surgery, and this is shown really great results, because a lot of times the patients had surgery and they come in and they might be in a sling and they're like, you want to move my arm? I'm in a sling. And that's what we've been asked to do. And so building that trust before the surgery, so they come in and they're not seeing you for the first time, they're not feeling your hands on them for the first time, really helps develop that rapport, that trust that we've already touched on. So I've really enjoyed that, because
I think that's, go ahead.
Oh, I was just gonna say, I've really enjoyed it because I really get to know the patient, not in their weakest moment. And, I get to meet them, and then they come back in and they know that I'm on their team. Like, I'm here to work for you, not for myself.
I could just imagine somebody that's really wounded and coming in and saying, you're gonna do what?
Yeah. And we have nicknames. People call us physical torturists and stuff like that. And I always just say to them, you drove yourself here. Like, you came to me. But it's true. It's not always fun. When they say, I need you to do this, and you're like, I don't want to. But the patients that buy into it, they keep coming back.
And they see results.
Exactly. And the biggest compliment is when, you hate to say this, but when the patient comes back to you for a different injury, or they refer a family member or a friend, you've done something right and really helped them. Yeah.
I know that you've taken your career in a slightly different direction, and you have an opportunity with Eastern Florida State College to design a physical therapy program.
It's actually a physical therapist assistant program.
Okay.
So it's a 2-year program. It'll be Associate of Science, and it's very exciting. We're currently in the process of the accreditation process with CAPTE. So we should be finding out shortly if we get candidate for accreditation. And if that's the case, we'll be able to enroll our first class in the fall, which will be super exciting. I've been working on this program for 2 years with the help of another clinical coordinator, as well as the rest of the faculty here at Eastern Florida. And it's going to be a great program for this area. There's definitely a need. There's students that are wanting to pursue, and there's also clinical community is really excited about having our students as future employees. Yeah. So the requirements will be somewhat similar to a PT program in that there's certain class sciences that they have to take, and then they'll still have to sit for a board exam after graduation. But it's going to be really exciting. The faculty and the administration here at Eastern Florida is so on board with it, and it's just really exciting to be part of an institution that cares about quality education.
Yeah. Who would be a good candidate for that program? Just in case, because we got a large viewership here.
Again, it goes back to what makes a great therapist. So somebody that's going to be a good clinician, that's able to engage with people, that's willing to, help somebody else do something that they want to do, not what you want to do. Somebody that has, maybe a science background or a desire to have a science background. Anatomy and physiology is huge in what we do. Yeah. And so having a basic understanding of that is obviously going to help make them successful. But really, sometimes students just need to explore their options, and a student that's maybe shadowed it and has a desire to be a PTA is really the best candidate.
Yeah.
Because
and what kind of roles might they move into?
They can move into similar roles as a PT. They'll never, unless they go to physical therapy school, they won't be a physical therapist, but they could do different credentialing tracks, and they could move their way up in management. There's no limitation for them.
Okay, so they have a good foundation
they have great
as
options.
well, and good options. Well, Kristin, thank you so much for being with me.
Thank you for having me.
Well, on behalf of my guest and everyone here on the set of Your Career, thank you for watching, and remember, be career happy.
More information about this program is available online at millermediagroup.org.